Hello everyone, this is Christine KANAN with the DentaQuest Partnership. Thank you so much for listening into this virtual presentation. I will be providing a high-level overview of the COVID-19 oral health recovery and transformation community. The COVID-19 pandemic has directly challenged the ability of dental care teams to implement the traditional system of care delivery. As shelter-in-place orders from state governments closed or significantly limited dental care delivery, dental care teams made new infrastructure investments to provide virtual care and respond to urgent needs. The reopening of dental care sites created multiple challenges to address. These included infection control changes, aerosol management, reestablishing patient and employee trust in the safety of care, and addressing financial challenges that will impact business operations. Ultimately, the COVID-19 pandemic illuminated the incompatibility of 20th century dental practice and its financing with an evolving virology environment. In its wake, the nation faces an imperative to reconfigure the organization and financing of oral health care. To respond to the rapidly changing dental landscape, the DentaQuest Partnership for Oral Health Advancement has developed a learning community structure and clinical domains to provide support and guide care for dental practices. The 3 domains of care re-engineer the structure of oral health and encourage diversification of dental business models by creating a trajectory for sustainable delivery of oral health care. The nonlinear framework proposed here allows for simultaneous dedication to multiple areas of operation based on need and willingness to invest. It also promotes a more efficient process for care model management and a stepwise approach that can be utilized within a care continuum. By working within these 3 domains, the DentaQuest Partnership believes that dental practices will be better organized and prepared to operate in the new frontier of dentistry. A primary focus of Domain 1 is to build a convenience-oriented virtual approach to oral health care. As COVID-19 drove care teams to limit direct contact and overall exposure risk, telehealth is a tool that can be utilized to stay connected with patients and provide emergency access. The increased use of teledentistry brought about by the pandemic has also exposed opportunities to re-engineer the traditional care pathways to a focus on prevention and disease management. Domain 2 focuses on non-aerosol secondary care that can reverse early disease stages or slow the progression of active disease, alongside anticipatory guidance and coaching. These proactive processes provide a step towards the management of a chronic disease as opposed to reactive treatment of acute situations. Domain 3 enables dental practices to include aerosol-generating procedures, in compliance with emerging and evolving infection control procedures to mitigate the risk for COVID-19 spread to dental providers and to patients. The DentaQuest Partnership as an organization has been focused on oral health care improvement and collaborative learning as a means of advancing oral health for many years. We know that in uncertain times, when the way that we have traditionally operated is turned upside down, that one of the strongest and most efficient ways to overcome new challenges is through collaboration. By talking with colleagues and others going through the same challenges and tackling the same issues, we are often able to learn and adapt more quickly and more effectively. The court learning community has a few major components to help dental practices navigate through the 3 domains mentioned on the previous slide. Monthly community calls are virtual touchpoints that offer dental practices the opportunity to receive relevant support related to dental practice recovery and the 3 domains. These monthly meetings are interactive, and they're not just webinars. This is really where the peer learning opportunities come in, and teams can come together, they can share some, and then they can learn some. Core Community Hub is a virtual community where dental practices can ask questions of peers, share best practices, and access relevant clinical content and industry guidance. Court participants also have access to expert faculty that will provide virtual opportunities for individualized support and assistance throughout the implementation of the 3 domains. The DentaQuest Partnership for Oral Health Advancement's ultimate aim is to learn with teams. We know dental practices will be working through new ways of practicing, and we strive to provide a community where folks can talk about the new strategies that they're testing and adopting and release the fear of failure. That is really what we're here to do, is to learn together and work through these challenges as a group. At the same time, we are utilizing data to capture participant experience. Impact, feedback, and team support will be gauged through a combination of qualitative surveys and quantitative data relayed on a monthly basis. Through data capture, we are aiming to illuminate the capacity of teledentistry to serve as a facilitator of effective revenue-generating prevention, present compelling evidence of the benefits related to minimally invasive model of care, emphasize the need for safe, sustainable, and diversified business models in dentistry, and ultimately hear from teams about their needs, facilitators, barriers, and provide perspective to inform this work moving forward. The word cloud on the screen is just one snapshot or one summary of some of the challenges teams are facing and topics that we've heard that they're more interested in learning about. The DentaQuest Partnership is currently implementing this learning community structure with 17 Massachusetts dental sites. Participating teams were asked to complete a baseline survey to better understand their current environment, knowledge, and attitudes. Teledentistry, minimally invasive procedures, and infection control were all identified expressing issues from the teams. The results on the slide now demonstrate participant confidence levels around implementing the domains. This data is key in developing and sharing appropriate content to support participants. Additionally, this baseline data will allow us to survey participants at different intervals throughout the project and measure improvement and progress within each domain. We will continue to work with these teams over the course of the year and continue to learn, improve our approach, and spread this valuable knowledge to other dental practices. If you have any questions regarding this work, I've included my contact information here, so please reach out to me and I'll be happy to answer any questions you have in a timely manner. I just want to say thank you so much for listening in, and for more information, please visit the DentaQuest Partnership site at dentaquestpartnership.org/care-improvement/cohort dental transformation.